It's my feel-good breakfast show.
Hey, I'm Zanzi. Welcome back at your Feel Good Breakfast Show. It's Tuesdays, and that means it's Tuesdays, and we're choosing to bring you nothing but the good stuff and educate you when it comes to your health. So we often think of winter as cold and flu season, but for many people, especially those with respiratory sensitivities, it's also a time when the lungs face serious strain. And whether it's difficulty breathing, chest tightness, or managing a chronic condition, winter can especially be hard on your respiratory system.
I'm pretty sure you're nodding away if this does include you. And today we're joined by Dr. Shakar Motilal, specialist physician and pulmonologist, to help us understand the deeper story behind our symptoms and how we can care for our lungs more effectively this season. So Doc, welcome. Welcome back, let me say. Thank you so much for sharing the space with us.
Thank you very much for the invitation to join you today.
Yeah, it's good to have you back, man. Looking absolutely incredible. But more importantly, I think it's time to serve him, Zanzi, because this is a stressful time. A lot of people dealing with many issues. So let's talk about these issues, because obviously we have signs of lung distress, and some of us might just think, hey, it's a normal cold, right? But this might not be the case. So what are some of those subtle but yet important symptoms indicating that the lungs might not be coping with whatever it's dealing with?
You're absolutely right, and that's because many respiratory symptoms often mimic other benign conditions, making them easy to miss. And there are red flags which I always recommend to patients and people in general to watch out for.
Yeah.
These include persistent cough, especially when it's lasting more than 3 weeks.
Oh, wow, okay.
Whether it's wet or dry, but particularly if it contains blood or if it's worsening at night and waking a patient up. Other symptoms also include persistent shortness of breath, especially on minimal exertion or even at rest, unexplained fever, drenching night sweats, and unintentional weight loss. Recurrent chest infections, and as a rule of thumb, 3 or more infections a year, are another warning sign for patients to look out for. People who have low oxygen levels can sometimes manifest with a bluish tinge of their fingertips or even their lips. So that's important to look out for. And of course, anyone with sleep-disordered breathing can have excessive snoring at night, so much so that often their partner recognizes that they're snoring and waking them up, or it can be heard in other rooms. Alternatively, they may be very sleepy during the daytime and wake up at night with gasping episodes. So these are red flags to watch out for. And remember that early attention and prompt medical treatment can save lives, and that's where seeing a respiratory specialist like myself will help.
I would hope so. And I saw
like
Chris
that.
looking at her fingers there just to
I
check.
said, are they blue?
Listen, if you're coughing up blood, that's definitely a sign to
That's a
go and
telltale
seek some
sign.
assistance.
For sure. Now, Doc, for those living with conditions like asthma, for example, and also COPD, which is chronic obstructive pulmonary disease, maybe you could also break that down for us. What are some adjustments that they can make in their day-to-day living that can actually improve their well-being?
Great question. So asthma and COPD represent a spectrum of airways disease, in particular obstructive airways disease. But there are many lung conditions or diseases in general that confer a higher risk of infection or illness. And this can range from anyone with immunocompromising conditions like diabetes, cancer, persons living with HIV, other respiratory-related illnesses like interstitial lung disease or bronchiectasis, what we term scarring in the lungs, as well as patients who have cancer or on immunosuppressive treatment like cortisone. So these are your vulnerable at-risk patient populations, and winter is a particularly brutal time for these patients. Why? Well, because of increased exposure to indoor allergens. There's a higher incidence of respiratory infections, usually starting off with the flu, and also there's increased exposure to cold. Now, a useful tactic and guide for these patients is very simple. And firstly, during the winter when it's particularly cold, and actually it should be the norm always, is breathe through the nostrils. The nostrils are very important because what they do is that they humidify and warm air before it enters your airways.
Oh, smart.
At the same time, they contain hair-like particles, and these actually filter out and trap out mucus and secretions and potentially infections. Also, Our at-risk populations, including the asthmatics and COPD, should rely on preventative inhalers as opposed to the reliever inhalers. Prevention and preventative inhalers have been shown in studies to actually make a very big role in preventing what we term as exacerbations or worsening of these patients' conditions, and thereby preventing it from getting worse. So too, there are simple, easy to do strategies like we've seen in the previous pandemics, like mask wearing, which reduces the risk of droplet infections, hand hygiene with at least 70% alcohol solution, and also some degree of social distancing where it's practical. These vulnerable at-risk populations should also try to get vaccinated with tried and tested robust vaccine strategies that have stood the test of time for many decades now, like the influenza vaccine and pneumonia vaccine. And unfortunately, despite the controversy of other vaccines, these have been given less importance recently, but should not be overlooked. So those are my sort of survival kits for the people who are at risk, especially during this winter period.
Hey, Doc, you've come through with the perfect survival package, and I can't be more grateful that you've educated us and also given us an option in terms of what we need to do. And I think with your advice and for those that are assisting us, your lungs literally are working hard every day, as we've realized, and especially in winter, they need extra support. So clearly, if you are feeling chesty, congested, or just want to stay ahead of the season, you want to definitely speak to your pharmacist about the ADCOCK INGRAM OTC Winter Survival Pack. Now, it's a pack that is packed with essentials to help you breathe easier. And if you want some more tips on staying well this winter, then visit beprepared365.co.za.
I love that. The doc's coming in clutch with all the good advice, and so are your pharmacists. You stand the chance to also win 2,000 Rand cash. There's always something for you. So reply to the competition post on the Expresso social pages and tell us if you usually get a wet or dry cough when you get hit with a cold or a flu. We would love to hear. And don't forget to use that hashtag #AdcockOTCWinter. Now, these entries do close this Sunday, so make sure you enter ASAP, and T's and C's can be found on expressoshow.com. Thank you so much, Doc. We appreciate that insight.
Thank you very much. It's a pleasure.